12 hours postpartum, a temperature of 37.8 degrees 100.2 degrees should be reported. This may indicate an infection like endometritis or a UTI requiring prompt evaluation. Other vital signs such as respiratory rate, blood pressure, and pulse are within normal limits. 24 hours postpartum, lochia rubra is expected. It consists of bright red blood with small clots and is normal within the first 24-72 hours. Lochia serosa and alba occur later, and scant clear discharge is not typical at this stage. For mastitis, instructing the client to breastfeed frequently is crucial. This helps prevent milk stasis and promotes healing. Cold compresses and pain medication may be used, but breastfeeding should continue unless otherwise advised. During a 24-hour postpartum assessment, the uterine fundus should be firm, midline, and at the umbilicus, UU. This indicates normal involution. It should descend by 1 cm per day thereafter. Postpartum, bleeding heavier than a heavy period requires immediate evaluation. It may indicate hemorrhage or retained placental fragments, necessitating urgent intervention. Other symptoms like slight leg swelling or small hemorrhoids are less critical. 6 weeks postpartum, low estrogen can cause vaginal dryness, leading to painful intercourse. Lactation suppresses estrogen, which is a common cause of this discomfort. Other factors like abdominal fat or vaginal rugae are less likely causes. A third-degree perineal laceration involves a tear through the anal sphincter. It extends through skin, perineal muscles, and into the anal sphincter, requiring careful management and repair. Breast augmentation may sever ducts, impairing milk flow and limiting breastfeeding ability. This is a common complication when surgery is near the areola, affecting the ability to breastfeed without issues. A displaced uterine fundus to the right suggests a full bladder. A distended bladder pushes the uterus upward and laterally, increasing hemorrhage risk until voiding is facilitated. HCG levels typically return to pre-pregnancy levels within 3 to 4 weeks postpartum. This is when HCG is no longer detected, marking the end of its presence in the body after childbirth. Foul-smelling lochia indicates postpartum endometritis. This condition presents with fever, foul-smelling lochia, and uterine tenderness, requiring medical evaluation and treatment. For a boggy uterus and heavy bleeding postpartum, massaging the fundus is the priority. This immediate intervention promotes uterine contraction and helps control hemorrhage effectively. Red streaks on the breast in a breastfeeding client indicate mastitis. This requires antibiotics and continued breastfeeding to resolve the infection. Other symptoms like tingling or milk leakage are less concerning. Rho-D immune globulin, RhoGAM, should be administered within 24 hours if the infant is R-positive. This prevents maternal R sensitization and is crucial for R-negative mothers postpartum. Heavy lifting is contraindicated in the first 6 weeks postpartum after a perineal laceration repair. It increases pelvic floor strain and may disrupt perineal healing, unlike activities like sitz baths or walking. Proper breastfeeding technique involves aligning the baby's nose and chin to the nipple. This ensures effective milk transfer and prevents nipple trauma, unlike quick latch release or limited feeding time. The expected change in lochia postpartum is rubra to serosa to alba. Rubra lasts 3 to 4 days, serosa 4 to 10 days, and alba up to 6 weeks. This progression is normal and indicates proper healing. To prevent postpartum urinary retention, assist the client to void within 6 hours postpartum. Early voiding reduces bladder distension and improves uterine contraction, unlike fluid restriction or delayed ambulation. A postpartum client with a headache and blurred vision should be evaluated for preeclampsia. These symptoms can indicate preeclampsia-eclampsia, requiring urgent management to prevent complications. Non-immune postpartum clients should receive rubella and varicella vaccines. These vaccines prevent future infections and are crucial for maintaining health in non-immune individuals after childbirth.